Hello, my dear students. Today we talk about disease of liver. And before we talk and discuss liver disease, we should revise our knowledge about normal anatomy, structures, and functions of the liver. Liver is a most huge gland in our organism and most important gland of our GAT system. And anatomically, it consists from two lobes, from right one and left one. On this slide, you may see normal color and normal structure of a liver. In some diseases, we may see changes of its structures. And it's really important to know which function liver does in our organism. We are, first of all, it's synthesis of albumins and all other proteins in our organism. It's really important for formation of our blood plasma and for all other proteins in our organism. It's really important. The second main function is function of the intoxication. So liver will remodulate of toxin and made from them non-dangerous products. The third function is function of coagulation and regulation of homeostasis and hemacoagulation. So in case of liver disease, we may see a lot of problems with bleeding or formation of clots and thrombus, and it will be really dangerous for patient. Also, liver is a place of accumulation of blood in our organism, and it's just a function of accumulation of blood and some important products like glycogen, and so it's really important for our organism and for its energy ability. So, and also its function of bile production, and bile really necessary for our GAT system and for our nutrition. So it's the most important function of a liver, and in case of liver disease, we may see damage of this function or some problems with them. Histologically, you should know about the main important characteristics of a liver. A liver consists from a small lobes and histologically. Lobes is polyangelic structure. In the center of it we may see vena centralis, and after it we may see hepatocytes. Hepatocytes has bulk localization or forming bulk structures, and they localize like a stick. So it's really typical typical anatomical form of liver, and according to its structure, it's really easy to find it in the slide, in the glass under microscope. And third important formation is liver striate. Liver striate consists from vein, bile duct, and arteria. All of these formations are necessary for normal functional activity of the liver. So you may see a typical histological picture of liver here. So in case of liver damage, we may see manifestation of special clinical features like jaundice, and I hope you remember jaundice from our earlier classes when we discussed mixed degeneration, and there are three main types of jaundice. They may be parenchymatose, hemolytic, and obstructive jaundice. So in case of liver disease, we will have deal with parenchymatose and obstructive one. Sometimes, in case of increase of intoxication, we may see a hemolytic jaundice, but the most important is parenchymatose and bile obstructive. Hypoalbuminemia. Hypoalbuminemia is a result of albumin synthesized function of liver, of its damage, and we may see like a manifestation of this disease, formation of edema, like it's up like ascites and other places of accumulation of edema. Coagulopathy, and it's again associated with really important function of liver in or in synthesis of special products which necessary for coagulation. And as a result of coagulopathy, we may see DIC syndrome. It's syndrome of disseminated intravascular coagulation. Fetor hepaticus, increased serum levels of hepatic enzymes and increased of level enzymes will be manifestate all parenchymal injuries of liver. So we may see increase of these products in case of damage of hepatocytes only. Henicomastia because liver has some special products which will lead to overgrowing of glands of breast gland in men. Hepatic encephalopathy, which will be associated with damage of the intoxication function of liver, and we may see really difficult complications with decrease of brain activity, and sometimes we may see a coma or other types of disorders of congenital function. Hepatorenal syndrome and hepatorenal syndrome characterized by failure of liver and kidneys. So it's the typical features of all diseases of liver. So on this slide we may see typical manifestation of jaundice. Typical jaundice manifestation associated with icteric surface of skin and sclera. You may see this picture in a lot of different diseases which are associated with damage of liver parenchyma. Also, we can see icteric skin and small pointed hemorrhages on the skin. It's typical for liver problem too. One more photo with damage of vessels in case of liver disease. You may see spider angioma. It's associated with damage of blood vessels. So, and we should discuss the typical processes which we will talk about which we talk today. They are hepatosis, hepatitis, cirrhosis, and tumors of liver. So, we start from hepatosis. Hepatosis is a group of disease which characterized by dystrophy and necrotical changes of hepatocytes. So, according to course, they may be acute and chronic. All of them has second names. Acute hepatosis has second name like massive progressive necrosis of the liver, and chronic is fatty degeneration of liver. The second name of this process talk about typical morphological changes which happened in the liver in case of each of them. First of all, we should discuss about acute hepatosis or massive progressive necrosis of the liver. So, a few words about etiology of this process. This process may be associated with acute intoxications and poisons. It may be associated with poisons by alcohol or poisons with drugs and a lot of other source of poisons. This process usually has two stages. The first stage is stage of yellow degeneration, and this stage took something about 2 weeks. And stage of red degeneration, it starts from the third week of disease. The first stage of this process characterized by increased liver in size, liver has yellow color, and histologically we can see fatty degeneration of liver parenchymatose, fatty parenchymatose degeneration of liver. And in the end of this stage we can see necrobiotic changes in the liver and it will lead to infiltration liver by blood, and its colors will change to red color, and we can see formation of second stage of disease, stage of red degeneration. In stage of red degeneration, liver size will be decreased, liver has red color and dense consistent. Histologically, in first stage we can see a manifestation of fatty degeneration. It is accumulation of lipids in the hepatocytes. It's really usual picture for you because we have already discussed this pathological process a lot of times. We can talk about it a lot of times. On the second stage, we can see necrosis of hepatocytes. You may see area of necrosis in this part of the slide. So you should understand the typical manifestation of necrosis here. Typical manifestation of necrosis here is structureless cells, cells without nucleus, and sometimes we may see accumulation of the blood, but in this slide we couldn't see fresh erythrocytes in this area, but sometimes it may happen. Massive hepatic necrosis with bleeding and diapedesis you may see on this slide, and we can see liver decrease in size. It has dense consistent, and also it has red areas in its structure. So you may see it here. All of these red masses are masses of hemorrhagen, and also this pathological process will be associated with acute liver failure, and like a result of it we can see some problems in the skin, and which are associated with bleeding and small pointed or huge pointed hemorrhages, and they may localized in all parts of the organ or in all parts of the body. Massive central lobar necrosis, you may see it here. It associated with development of cirrhosis in the center of lobe of liver, and you can see its manifestation here. One more photo with cirrhosis, with necrosis, excuse me. You may see manifestation of necrosis in this part of the slide, and a big area of hemorrhage here. You can see fresh erythrocytes. It's typical picture for necrosis of liver. So it was all information about acute liver hepatosis, and we should discuss chronic degeneration of liver, chronic hepatosis of liver. It's fatty degeneration of liver, and it has special forms. Special forms associated with different size of lipid droplets in the hepatocytes with different localization of the process. So you may see all of these forms on the slide. They are pulverized, small droplet, large droplet, disseminated advesity, zonal advesity, and diffuse advesity. All of these forms has different macroscopical and microscopical characteristics, and all of them associated with different size of pathological area. Stage of fatty degeneration include simple adversity, and in it we may see only accumulation of fats in the hepatocytes without any other pathological processes. So we can see only fatty degeneration without necrosis and without difficult problems in liver. Adversity with hepatocytes necrobiosis and mesenchymal cell reaction. So we can see huge accumulation of lipids here and development of necrobiosis and necrotic process in the surrounding tissues. And in the outcome of this stage, we can see remodelation of liver, which is associated with formation of connective tissue, and sometimes it may lead to cirrhosis of liver, and this disease will have a lot of complications. On this slide, we may see macroscopically a fatty degeneration of liver. This liver has special name like goose liver, and we have already discussed it in our first classes. So liver is enlarged in size, it has yellow color and flabby consistent. The special name for it, I should tell it again, goose liver. According to histological picture, we can see a lot of cells with empty spaces, and these empty spaces associated with accumulation of fats. On exam, we will ask you why these places are empty. These places are empty because of lipids disappear by according to alcohol injury. So in case of staining, we use alcohol, which leads to disappearance of fats from the cells. That's why they looks empty. And on this slide, we may see hematoxylin-azine reaction. It's usual staining in pathological anatomy. On this slide, we may see elective staining for lipids with Sudan-free, and lipids becomes a orange color, and we can see accumulation of it here and in all part of the slide. So I hope you remember all elective staining for lipids. They are Sudan-free, Sudan-4, Charlag, osmium acid. It's the most important staining for lipids, and I hope you will remember it on exam. Hepatitis. Hepatitis is a disease of liver which is characterized by inflammation in this organ. According to classification, there are a lot of different ways of its classification. They may be primary and secondary. They may be acute and chronic. So primary hepatitis associated with injury, firstly injury of liver. Secondary hepatitis associated with chronic disease, which leads to, like a complication, leads to liver injury. According to course, there are acute and chronic. We have a different duration of acute and chronic, but more common characteristics is acute less than 6 months and something about 2 months maybe, and chronic more than 6 months. Process duration more than 6 months. It's chronic hepatitis. The most important for us in our department is primary hepatitis with primary injury of liver. And according to etiology, they may be very different. It may be associated with virus injury, and we will talk about today about virus hepatitis. Alcohol injury is really interesting and really difficult in nowadays because a lot of people in all world have some problems with alcohol now. Drugs, etiology of hepatitis associated with treatment of other processes and using, for example, corticosteroids or anti-inflammatory therapy will be associated with hepatitis, and like a complication may lead to cirrhosis. It's really important to know about it. And two rare forms like autoimmune hepatitis, when our immune system damage hepatocytes, and this process will lead to autoimmune hepatitis. And cryptogenic. Cryptogenic in medicine is some processes which etiology we really don't know in nowadays, but probably in few years we will know about them more. Viral hepatitis associated with viral injury of liver, and etiology may be virus of hepatitis A, B, C, D, and so on. And nowadays, the last virus of hepatitis probably H, if I didn't mistaken. So, viral hepatitis A. The same name, or the second name for this disease, is Botkin disease. Its etiology is RNA virus of hepatitis A. Transmission way is fecal-oral. Incubation period very small, something about 15 or 45 days. This type of hepatitis characterized by epidemic course and more typical for childhood and manifestate itself more common in children, and typical ways of infections from child to child. And on this slide you may see typical manifestation of a proteus. We can see jaundice in icteric sclera, and in morphological characteristics we may note dystrophy in hepatocytes. But it is one of the lightest type of viral hepatitis. It has benign course and more often will end without any complications. Viral hepatitis B, it's really a dangerous disease, and we, like medical workers, are in the group of the risk, because the most important way of absemination is parenteral, and it means that virus spreading with blood and other liquids of body of patient who ill. So etiology is DNA virus, and you may see photo in this part of the slide, and incubation period of this infection something about 25-180 days, and this type of virus has typical chronic course. Typically it has chronic course. In case of chronic hepatitis we can see dramatically changes in liver anatomy, which usually lead to cirrhosis, and after cirrhosis we can see formation of hepatocellular carcinoma. That's why this type of virus really dangerous for patients, because it has really difficult complications and malignant, no, not malignant, but non-likely course. It leads to difficult complications. Like a satellite of B virus hepatitis, we can see viral hepatitis D. It formed from the virus hepatitis B, and it's a defective RNA virus which formed in a mistake of transcription of B virus, and it looks like B virus, but it's smaller and it's RNA virus. It manifests itself only in the presence of a virus B antigen hepatitis. One of the most dangerous viral hepatitis is viral hepatitis C. Its second name is silent killer because after between infections and manifestation, sometimes period may took something about 20-25 years, and usually it has first primary chronic course and leads to silent changes in the liver without any clinical or symptomatic manifestation, and it manifests itself only in stage of cirrhosis and cancer of liver. Etiology of this viral infection is RNA-containing virus. Transmission pathway is parenteral. In 30% of cases, the transmission of this infection is not set, because really long period between infection and manifestation of it. All of viral hepatitis has special clinical and morphological forms. We are acute cyclic form and acute cyclic form characterized by period of jaundice and light periods. Also, it may be non-icteric type, necrotic type, and necrotic type of viral hepatitis, also called like malignant, because it leads to really a huge area of necrosis in the liver, and it probably leads to necrosis and really difficult complications. And like an outcome of this process, we may see death of patient or formation of post-necrotic cirrhosis. Few words about it I will tell in the end of our class. Cholestatic form, which is associated with blockage of bile ducts in the liver and formation of bile thrombus in the liver, and it also has really difficult complication because it will be associated with auto intoxication by bile, and bile really dangerous liquid which may lead to dystrophy in hepatocytes, and sometimes it may have systemic toxic injury, and also chronic course of infections, and chronic course characterized by duration of infection more than 6 months. Acute cyclic form has some stage. Pre-ecteric form, in this stage we may see protein degeneration of liver, of hepatocytes, and I hope you remember some protein parenchymatose degenerations. There are 4 processes in this group. We are cloudy degeneration, hyaline droplet degeneration, hydropic one, and keratinization. So in hepatocytes, in case of viral hepatitis, we can see cloudy degeneration, and it's reversible process which may treat and after elimination of pathological agents we can see full recovery of liver structures. Also, it may be hydropic degeneration because all viruses may lead to formation of hydropic degeneration. And I hope you remember that hydropic degeneration is irreversible and in any cases will lead to necrosis. And this necrosis will manifestate itself by liver insufficiency. After it, we can see stage of the manifestation of disease, and this stage characterized by formation of parenchymal jaundice. Parenchymal jaundice associated with damage of hepatocytes and their necrosis. That's why we may see formation of jaundice. So manifestation I already showed you. You may see it so like ecteric skin, ecteric scleras, and so on. And after it, we can see recovery stage of restoration of liver, and liver or one of the organ which has really huge recovery potential. That's why almost in any liver disease, patient will survive for a long period because liver may remodulate itself and recovery of its structures. Morphological criteria of viral hepatitis characterized by protein dystrophy of hepatocytes, and on this slide we may see cloudy degeneration in hepatocytes. So I should tell it again, it's reversible process, and in case of development of cloudy degeneration we can fix pathological process if we eliminate the virus from the organism. Count-Siemens corpuscles accumulation, you may see it in this part of the slide. It's place of partial coagulative necrosis in hepatocytes, and its special characteristics of viral hepatitis. It's typical for formation of viral hepatitis, corpuscles of Count-Siemens corpuscles. You may see with homogeneous round cells with homogeneous pink cytoplasma. It's one of the typical manifestation of it. And also we can see proliferation in Kupffer cells. Kupffer cells, it's special cells which localized between hepatocytes, and you may see it like huge blue cells, so like this one. One more photo with all these manifestations. Arrows show you count semen bodies. It may looks like that or that. We can see rounded, homogeneous, pink masses, and it characterized by development of coagulative necrosis in these hepatocytes. Also, we can see manifestation of hydropic degeneration, and hydropic degeneration is reversible process which in any ways will lead to necrosis. And also we can see proliferation of Kupffer cells here and in this part of the slide. One more Kupffer cells. I hope it will be clear for you now. Typical microscopical manifestation of viral B hepatitis is formation of ground glass picture. Ground glass picture develops as a result of two processes. The first of them is formation of protein degeneration, like cloudy degeneration, and second one is accumulation of virus corpuscles in the cytoplasm of hepatocytes. That's why cytoplasm of hepatocytes looks like homogeneous pink masses with some special granules. Necrotic form of hepatocytes or malignant form of hepatitis is associated with really big area of necrosis with dramatically quick development of necrosis, and it's one of the most dangerous type of hepatitis because it's characterized by huge liver failure and difficult problems with functional activity of the liver. Acute hepatitis with secondary submassive necrosis, it's again necrotic form. You may see formation of nodes, of necrotic nodes in the surface of liver, and most of all, this type of hepatitis will lead to formation of post-necrotic cirrhosis, and this process will have really difficult complications here. Cholestatic form. Cholestatic form of hepatitis characterized by special morphological changes. It has macroscopically, liver has green color, and histologically we can see bile thrombus in the bile ducts. So in this slide we can see this accumulation of these brown, yellow-brown masses in the bile ducts. It associated with blockage of bile ducts, and it may lead to damage of surrounding cells and bile, really dangerous liquid. Chronic viral hepatitis characterized by morphological evidence of elimination and necrosis plus lab or clinical evidence of liver disease for 6 months and more. Chronic viral hepatitis may have two different types. It may be persistent and active. Active chronic hepatitis characterized by significant collapse indicative of progressive to cirrhosis. So we can see really huge area of injury here, and it will be associated with active process in these areas, and it may be associated with development of the necrosis here and other pathological processes. Macroscopically, it's look like that. You can see area of hemorrhage here and formation of some special nodes in these areas, and it can associated with perilobular and centrolobular infiltration and development of inflammatory reaction here. That's why in the outcome of this type of hepatitis we can see development of cirrhosis. The limiting plate regeneration are blurred due to an inflammatory infiltrate, so we can see it here, and in this part of the slide we can see accumulation of connective tissue, so it's pre-cirrhotic changes. Persistent hepatitis characterized by accumulation of inflammatory masses in the portal in the place of port of vein. So, alcoholic hepatitis characterized by fatty dystrophy and necrosis of hepatocytes, formation of Mallory corpuscles, and prevalence of neutrophilic in the infiltrate. On this slide, we may see accumulation of neutrophil here, fatty degeneration in this place, and Mallory corpuscles I will show you on this slide. You may see here. I hope you remember few information about Mallory corpuscles or Mallory bodies. It's we did have already discussed it when we talk about protein parenchymatose protein degeneration, and in case of Hialin-Ropley degenerations, we talk about formation of special abnormal protein like alcohol hyaline, which localized in the hepatocytes. And this process is reversible. This hyaline couldn't be disappeared from the hepatocyte, and it will lead to degeneration and decrease of functional activities of hepatocytes. On this slide, we also can see formation of fatty degeneration here and here. Few words about alcohol hepatitis and its epidemiology. Nowadays, alcoholism is really a huge problem in all world, and it may lead to really huge problem with the health. For development of alcohol hepatitis and cirrhosis, patient should drink more than 100 milliliters of alcohol every day for duration something about half of a year. That's why we can see really fast development of this pathological process in some cases. And it's really difficult to treat it and really difficult to eliminate all pathological changes in the liver after alcoholism. You should prevent development of it in your patients due to some speaks or tells with your patients, and you should give them information why alcoholism is dangerous for their health. Cirrhosis. Cirrhosis is a chronic disease of liver which is characterized by hepatic failure due to structural reorganization of liver. When we talk reorganization, we mean formation of fake lobes. Fake lobes is an anatomical formation which consists from hepatocytes but doesn't contain vena centralis and liver striate. And these fake lobes characterized by abnormal functional activity. Morphologically, morphological manifestation of cirrhosis. On this slide, you may see normal liver and liver in case of cirrhosis. So in case of cirrhosis, in any case of it, liver decrease in size and has orange color or close to orange. It has solid consistent, and its size is decreased. According to etiology, there are infectional cirrhosis which associated and which develops in the outcome of viral hepatitis, toxic cirrhosis which associated with post-necrotic cirrhosis and associated with acute hepatosis and associated with chronic intoxications like alcohol or drugs or other types of intoxications. Biliary cirrhosis associated with blockage of bile ducts in the liver, and we may see really difficult complication of this, because bile is a really dangerous liquid which may lead to some degeneration and necrotical processes in the liver. Also, it may be elementary type of cirrhosis. Elementary type of cirrhosis associated with some problems with food and nutrition of the patient, and we may see development of it in this case. Circulatory type of cirrhosis associated with problems of blood supply to the organ and associated with development of portal cirrhosis. And a cryptogenic type of cirrhosis when the direct cause is unknown. According to morphogenesis, there are three main forms of cirrhosis. Post-necrotic cirrhosis, and it's developing the outcome of acute hepatosis. Portal cirrhosis, which is associated with blood supply problems and develop like these circulatory disorders of the liver. And biliary cirrhosis, which is associated with problems with bile ducts. On this slide, we can see post-necrotic macronodular cirrhosis. It characterized by formation of regeneration nodes more than 2 or 5 centimeters in the diameter. It may be diffuse and localized in a really big area of liver, and it develops as a result of acute hepatosis and develops after necrosis. It may be malignant viral hepatitis leads to it, or intoxication by drugs or alcohol and formation of necrosis in the liver. And after necrosis, we can see fake lobes and regenerate nodules in the liver, like here. Liver has orange or yellow color. Portal micronodular cirrhosis. In this case, we can see problems with blood supply to the liver, and liver has again orange color, but regenerate nodules will be smaller than 1 centimeter, and it characterized by diffuse damage of liver, and it's really difficult for treatment and difficult for patient to have a portal cirrhosis. And biliary cirrhosis characterized by formation of some green spaces here, and these green spaces is associated with accumulation of a bile in the pathological areas. Histologically, we can see formation of fake lobe, and fake lobe you may see here. So we can see hepatocytes, but we couldn't see central vein and striate of liver on this in these formations. And sometimes it may be associated with development of fatty degeneration and necrosis in this area. Fatty degeneration in these conditions will be associated with two main factors. The first of them is chronic intoxications, which are typical for all cases of cirrhosis, and also it will be associated with intoxication and hypoxic condition also. Complications of cirrhosis. Complications of cirrhosis associated with portal hypertension. It's increase of blood pressure in the portal system, in system of portal vein, and it associated with opening of anastomose, and we can see a lot of special veins in the esophagus, in the front abdomen wall, and it may be associated with formation of ascites, and it will lead to really huge problems in case of bleeding from these veins. Most typical complication is bleeding from veins of esophagus, and sometimes this bleeding will lead to death of patients. Also, we can see decrease of deintoxication function of the liver, and in outcome of this process we can see encephalopathy. It's damage of brain, which is associated with accumulation of toxins in the blood, and we can see decrease of mental functions of our patient, and sometimes it may be associated with coma and other uh, disorders of mental activities. Also, in the outcome of cirrhosis, we can see hepatocellular carcinoma. It's a malignant tumor from hepatocytes, and also development of hepatorenal syndrome, which characterized by kidney failure and liver failure. On this slide, we may see manifestation of portal cirrhosis, of portal hypertension, and we may see caput medusae, or opening of anastomosis in the front wall of abdomen. We can see vein in this localization, and also we can see vein in the esophagus. The varicose disease in the esophagus will be associated with rupture of these veins by a piece of food, and it may lead to bleeding, and bleeding may lead to death of patient. So, and in the outcome of cirrhosis, we may see liver cancer. Anatomical form of this disease may be nodular, and in case of nodular form, we can see formation of node of tumors node something about 5 or 4 centimeters in diameter. In case of massive type of liver cancer, we can see formation a lot of nodes here, and in case of diffuse injury, we can see the image of all surface of liver, and it looks like cirrhosis, and it's really difficult to find diffuse cancer macroscopically. We should do histological examination, and only according to the result of it we may see correct diagnosis. According to histology, there are two main forms of cancer. So I should revise you what does mean cancer. Cancer is a malignant tumor from epithelium. In the liver, we can see two sources of cancer growth. We are hepatocellular carcinoma, it's cancer from hepatocytes, and cholangiocellular carcinoma, it's cancer from epithelium or bile ducts. On this slide, we can see nodular form of cancer, and it looks like node, something about 5 or 4 centimeters in the diameter. On this slide, we can see massive type of cancer, of liver cancer, and it characterized multiply nodes in the liver, and sometimes we should differentiate this form from metastatical process from cancer with another localization. For example, cancer of stomach, and its metastasis to the liver will looks like same. And diffuse cancer is really difficult to differentiate this form from cirrhosis, because we can see total injury of liver, and only according to microscopical examination we can see a correct diagnosis. And histologically we can see picture like that. On this part of the slide we can see healthy hepatocytes, and we can see border between normal cells and atypical cells. So I hope you remember typical manifestation of malignant tumor. Malignant tumor characterized by morphological atypism, cellular and tissue, and most of all it's cellular atypism. So we can see cellular atypism here. All of cells are different, their size is different, they don't look like normal cells, and they has different nucleus, and also we can see pathological mitosis in these localizations. So it's all theoretical part for today. Thank you for your attention and goodbye.